So what is it? It's a heart rhythm disorder caused by abnormal electrical signals in the lower chambers of the heart. VT can last for only a few seconds, or it can last for much longer. Healthy heart beats from 60 to 100 times a minute at rest. But with ventricular tachycardia, it beats about 100 or more beats per minute. So causes. It most often occurs when the heart muscles have been damaged and scar tissue creates abnormal electrical pathways in the ventricles. It can also be caused by poor blood flow to the heart, congenital heart conditions, medication side effects, or the use of drugs such as cocaine or methamphetamine. So symptoms are dizziness, shortness of breath, lightheadedness, feeling as if your heart is racing, your palpitations, chest pains, loss of consciousness, or cardiac arrest. It's important to see a doctor when chest pains last for more than a minute. Do you have difficulty breathing or have fainting spells? So diagnosis, doctors will do an electrocardiogram. An electrocardiogram detects and records your heart electrical activity using small sensors called electrodes attached to your chest and arms. Your doctor may also ask you to use a portable ECG. This can be done through a Holter monitor, which you wear around your neck or in your pocket, which detects your heart activity for over 24 hours, or an event monitor, which is a small monitor that sticks to your chest, which monitors your activity for a few weeks or months. An electrophysiological test is when your doctor will insert thin, flexible tubes called catheters tipped with electrodes into your arm, groin, or neck, and guides them through your blood vessels to various spots in your heart. Cardiac imaging such as an echocardiogram, MRI, CT scan, coronary angiogram, which helps doctors study the flow of blood through the heart and blood vessels, which can help detect blockages or abnormalities. And then a stress test is used to see how your heart functions under stress and exercise. Electrodes will be placed on your chest to see how the heart functions while you're exercising. So treatment, the main treatment is medication. So VT can go away on its own within 30 seconds, and this is called non-sustained ventricular tachycardia. Or it may last more than 30 seconds, called sustained ventricular tachycardia, which this requires immediate medical treatment. So for those who have sustained ventricular tachycardia, doctors will want to restore the normal heart rhythm with electrical shocks. They may also insert a defibrillator. Defibrillators just are little things that are inserted into your heart area, and they just monitor the heart rate. So if your heart beats faster than normal, it'll send a shock to your heart, restoring the heart rate. And then open heart surgery is needed if there is a blockage in the heart causing the tachycardia. Or there's a procedure called a maze procedure where the doctor makes small incisions in the heart tissue to create a pattern or maze of scar tissue, because scar tissue does not conduct electricity, and this interferes with the stray of electrical impulses, causing some types of tachycardia. And then prevention, exercise and eat a healthy diet, maintain a healthy weight, keep BP and cholesterol pressures under control, don't use recreational drugs, limit alcohol use, limit caffeine, stop smoking, and then use over-the-counter medications with caution. So risk factors, other heart diseases, medication side effects, severe electrolyte imbalance, or use of drugs like cocaine and methamphetamine can all help cause ventricular tachycardia. And then complications are frequent fainting spells or unconsciousness, heart failure, or sudden death caused by cardiac arrest. So prognosis and follow-up. If you detect this disease fast enough and get the heart rate under control, you can live a regularly normal life, take medications and follow up with doctors regularly, and seek medical attention if fainting spells continue. And this was my